Now, in the third section, we will talk about some operational parameters of the lasers. And in this, we will talk about the mode of the lasers, delivery system of the lasers, and what are some advantages and disadvantages of the use of the laser. So the operational parameters of lasers, we have wavelength of laser, as we already mentioned in the previous section, that wavelength of the laser is very, very important parameters that is responsible for the effect of the laser on the tissues. If the wavelength is smaller, the penetration is less deep, and then it scatters more also with the smaller wavelength. If the wavelength is between 380 to 760, those lasers are visible lasers, and then other lasers are invisible lasers. More precautions needs to be done for invisible type of lasers, because we cannot see those lasers and where they are reaching and the excess. So different wavelength is very, very important parameter of the laser. So wavelength of laser. Power of the laser, exposure time, how long we are exposing the tissue to the laser. Spot size, big or small, and power density, fluence or radiant exposure. We will go over these terms one by one also. What's the power density? What's the fluence or radiant exposure? So power density. Power density is the power, how much power. Density is the amount of energy or power delivered to the tissue is power density. Power delivered per unit area of spot size, and is measured in watts per square centimeter, which is the area per unit area of the spot size where the laser or where the beam is applied. So that's the power density. Indicates the intensity of the beam. Power density, that's the formula how we calculate the power density, which is the power in watts / area of the spot in square centimeter. That gives us the power density. So the power in watts over the area of the spot in square centimeter, that's the power density. Then we have fluence or radiant exposure. Fluence or radiant exposure, power density, once we get the power density, multiplied by duration of exposure in seconds and measured in joules per square centimeter. That's the fluence or radiant. So now how much density is given now, and how long is the duration of exposure? That's the fluence or radiant exposure. Indicates total energy delivered to the tissue per unit area. Fluence power density measured in watts times the seconds of exposure or the duration of exposure of the spot, that's the fluence, and it's measured in the joules. Next is the mode of the laser. Mode, we can have continuous mode, and the continuous mode provides the constant stable energy. It's in the continuous mode. Continuous mode provides the constant stable energy. Active medium is continuously kept in a stimulated mode. So that's the continuous mode. Then we have pulse mode. The mode is broken down into pulses. So interrupted beam. That's the pulsed mode. Active medium is intermittently activated for a short time. Then the Q switched mode. Q switched mode is very short pulses in controlled manner. Pulse range between 10 nanoseconds and 10 microseconds. So we have three different modes: continuous mode, pulse mode, and then we have Q switched mode. One is continuous application of energy, then we have interrupted beam for a short time, and then the Q switched, which is very short pulses. It's applied for a very short period in a controlled manner. So that's in these three diagrams you can see the frequency and intensity of the beam. So this is one with the laser gain bandwidth. This is the cavity longitudinal mode structure, and this is the laser output spectrum. So three modes are used. The delivery system of the laser articulated arm used for carbon dioxide laser, as it does not pass through optical fibers. So for carbon dioxide laser, articulated arm is used. Optical fibers require micro manipulator or handpiece at end of articulated arm containing reflective mirrors. So optical fibers require micro manipulator, very small manipulator. Optical fibers are very small, about the hairs, even small the size, and then it or handpiece is present at the end of articulated arm containing the reflective mirror for proper visualization. Near infrared, ND-YAG and visible lasers, Argon and KTP, can pass through optical fibers. Invisible lasers require an aiming beam, for example, helium neon, of visible light to locate the spot. So these are the different delivery systems. Some lasers can pass through optical fibers, some require articulated arms, and some with the reflective mirrors because they cannot pass through the optical fibers. Now some advantages and disadvantages of laser. Advantages: we have precise incision. As I mentioned, very precise incision is given, not the wide laparotomy incisions to access the structure. So very precise incision is one very important function of the laser therapy. Easy and rapid ablation of tissues, excellent hemostasis, minimum post-operative pain, minimum edema of the tissues, less handling of the tissue, less manipulation, and less edema. Ablate tumor situated in difficult locations because we can easily access different areas. Now some disadvantages are: the cost is high. Special training in operating with lasers requires special precautions and safety measures, special anesthesia requirement. So there are some advantages and some disadvantages, but advantages are more. The only disadvantage mainly is the high cost and special training required. Other than that, we need the smaller operation area, smaller access area. It can access to the areas which are not accessed by other ways, and then there is rapid minimum excellent hemostasis, minimum injury, minimum edema. So all these are the advantages of the laser therapy. So that was all about section 3. Thank you for watching sqadia.com.